Hello, I'm Jonathan Bigg from the Forensic CAMHS team. I'm here today to talk to you about fire setting. Fire setting is a more common behaviour than one might expect. It's usually a normal part of growing up and exploration of the world, and fire holds a fascination for many people, and I have to say that includes me. There's little widely applicable guidance for accurate understanding and for working with children who set fires. There doesn't seem to be good evidence to support the idea that there are well-defined types of fire setter, linking to guidance for interventions or to improvement of prediction of risk or outcomes. Key, we think, is to understand details of the case one's dealing with, in particular what's actually known about what happened. How much malign intent was there, for example? What's the young person's relationship with fire and their understanding of whatever it is they've done? How does it fit with other aspects of antisocial or risk-taking behaviour they've displayed? What's the child's family, educational and social context? Like with all aspects of childhood development, interest and awareness of fire changes over time. So when children are particularly small, they'll probably have some degree of interest in these exciting, flamey things. When they get a little older, maybe 5 to, as they start turning 10, they may start making the odd fire. This tends to be called fire starting or fire play. Fire setting is perhaps from 10 onwards, and this probably more accurately involves a bit of thinking, maybe a bit of planning, but not always to a sinister degree. Sometimes it can be, rarely. More often it's about exploration and often done in group activities. You might be surprised to hear something like 40% of children set fires in this normal kind of a way. So for under 10s, there's generally thought to be less full-on intent around fire, so frequently fire starting might end up being an accidental thing. Perhaps they've got some matches, surprise themselves that a fire happens in some sort of a way. Or they might be getting practice at starting more coherent fires with a family member, a bonfire or what have you. So learning about how fire gets going. Perhaps older and with a bit more understanding and intent comes the fire setting. And that's something that might involve, as I've said, a bit of planning. Maybe materials have been collected beforehand, maybe accelerants, so petrol, paper, piles of sticks, etc. So much less accidental when the fire actually happens. So what kind of emotional function can fire setting provide for a person? Fire setting can be a response to stress, involving impulsiveness, emotionality, reduced sociability and assertiveness in a young person, and such a child might be thought of as filling the criteria for the only viable option theory postulated by Jackson in 1987, following anger feelings, following maltreatment. So what's the family context of fire setting behaviours? We know more concerning fire-related behaviour involving perhaps increased frequency and resourcefulness in organisation of it can be associated with adverse childhood experiences, family dysfunction, and particularly including too much or too little discipline. There are mental health associations, for example, use of mind-altering substances, a tendency towards sensation-seeking and psychological distress are pretty closely associated, as are emotional dysregulation and actually undergoing treatments for mental health disorders, taking prescribed medications, having depression, self-harm and ADHD diagnosed. There are weaker associations with anxiety and other sorts of mental disorder. Callous unemotional traits, low empathy and poor school achievement are closely associated, and interestingly, although in the US they've found some associations with class and social status, those haven't really been shown to be factors in other parts of the world. Fire setting is associated with fewer protective factors. These would be things such as self-esteem, optimism, problem solving, support from family and friends, and inhibitory control. And the implication of that is that building on strengths and resiliency may be significantly helpful. There are sex differences. Males set fires more often than females. Females that do tend to show more psychiatric disturbance. Emotion dysregulation, anger and dissociation can be higher in females. In adults, motives differ between the sexes as follows, as far as we understand. For males, revenge is top, suicide is second, excitement, then profit, then breakdown in relationships with intimate partners comes fifth in that list. Slightly different for females. First is frustration. Second, like with males, is revenge and then suicide, second and third. Attention seeking, in quotes, not entirely sure what that means, is fourth. And self-defense as a means for fire setting can happen, is fifth in the list for adult women. Intellectual disabilities. There are probably higher rates of fire setting in those with intellectual disabilities, but it's hard to estimate the true prevalence. Likely there's less awareness of the needs of others and of the consequences, there's less impulse control, impaired moral reasoning, but these are not at all well-researched hypotheses. For some it may be a more direct non-verbal communication and or more functional in achieving certain predictable outcomes. Overall, there are research evidence limitations. There's little UK or worldwide research relating to adolescents. Much of the evidence is dated, and very few studies on mental health intervention and follow-up in intellectual disability populations has been made. Interventions for fire setting. These fall primarily into two areas: fire safety education and CBT-based strategies, or a combination. Fire setting education isn't so readily available nationwide, but Hampshire and Isle of Wight Fire and Rescue Service provide their Firewise programme, well thought of for many years. It tends to be used for low-risk fire setters. Persistent fire setters' interest is said to reduce by about 65%, and non-persistent fire setters' interest by about 90%. A one-year follow-up showed a 15% recidivism rate, doing the same thing again. Mental health interventions are taken from so-called dynamic behavioural model, social learning model, and biopsychosocial multi-risk factor model. These are said to be recommended for higher risk fire setters. Techniques for this include so-called interview graphing. This is collaborative with a young person. It helps connect events, feelings and behaviours in an ABC sort of CBT model. It's said to be highly effective in reducing recidivism. Techniques also involve developing problem-solving skills and building inhibitory control. Outcomes for fire setting intervention. In 2001, fire setting education was shown to be best for reducing recidivism. But in 2012, CBT was shown to have the strongest treatment effects and provided the largest reduction of fire setting. A 2012 study showing combination was most effective, but there was limited strength of evidence and there have been few studies overall. For intellectual disabilities, there have been very few studies, and overall there's a lack of evidence of what might be useful. One needs to build a relationship, to go slower through the intervention process, to repeat learning over time, as with a lot of interventional requirements for people with intellectual disabilities. So, in summary, there's no single evidence-based way of understanding or of intervening with fire-setting behaviours. Each case needs taking on its merits, according to the precise behaviours presented, the circumstances of those, the various family, school and other social factors associated with the child and their presentation, and the mindset of the child involved, both in general and at the time of the fire setting. So overall then, at the end of this video, hopefully you've got more of an understanding of the extent to which we can understand fire setting and the limitations that we have for meaningful intervention in any fine-tuned way. For more information, please look at the Hampshire CAMHS website, the Forensic CAMHS section within that, where you'll find extra information, maybe some interesting things to look around as well.